cancer journey is a long one. Even just being told you have cancer, it just sparks a lot of anxiety, because people have been told with cancer you don't get healed, and this and the other, and they will tell you you've been bewitched, and so many things happen at the time of diagnosis. Nobody ever is willing and ready and happy to receive a cancer diagnosis. So in psycho-oncology, we journey with our patients right from the time of diagnosis. Even before diagnosis, when somebody is suspected to be having cancer, they need help. They need psychological help, and all that is in what we do as psycho-oncologists. When they are going through treatment, there are many side effects. The drugs have so many side effects. Some of them are physical, and other effects are social. People lose their jobs, you can't go to work anymore.
So what Beautiful Ashes is about, it's an initiative that has been birthed to sort of provide support to cancer patients, to their caregivers, and to every single person that has been affected, because in one way or the other, we've all been affected by cancer. There's been a rise in the number of patients that are diagnosed with different cancers. Many breast cancer patients, prostate cancer patients, lung cancer, so many different cancers. And there's been a gap, especially here in Uganda, in the sense that patients receive treatment, they do, but caregivers have sort of been left out, and yet they also face the trauma of this thing. The other hand also is that patients do receive the treatment, but mental health support has been lacking in our system. So Beautiful Ashes initiative is here to fill that gap, to see that once the diagnosis is given, people don't have to feel like it's a death sentence. People can still have hope, because for many of these cancers, by the way, they are preventable, they are treatable, especially if caught early, if screening has been done early. But in the case that someone has been diagnosed late, they can still have hope.
Health is important for everyone, including men, women, children. Mental health is important because not everyone knows what people are going through in their homes. But when it comes to cancer, it is more important. I would like to say it's most important in cancer and other chronic diseases, because at times people are confused, they don't know what comes next, and almost everyone that hears the word cancer hears death. So it is quite important for these people to be supported, to know that there is treatment.
They are stigmatizing people on chemo, preventing them from getting full treatment that would help cure this cancer. If we help people understand that you who is trying to stigmatize somebody, you could be having cancer silently. It's not okay for us to point fingers at people who need help. Already the cancer itself is a death sentence. Why must I now make it even more harder for this person? Can we come back to the basics? Can we love on people? So what we are trying to do now is promote sensitization, awareness, and also incorporate love, and let all stakeholders, from the patient to the care providers to the caregivers, to be